Hi, in this video, I'll be interviewing Rosie Ingebritson, who's a clinical oncology social worker. We'll be talking about anxiety during cancer and cancer treatment. What is it? How do you know if you have it? What causes it? And what should you do if you have anxiety? Welcome, Rosie. Thanks for being with us.
Sure. Thanks so much for having me.
I'd like to start with what is anxiety and how do we differentiate that from other things like stress?
So anxiety and stress and these other emotions that can go along with the cancer diagnosis, they are different. And so let's talk about sort of what anxiety is, what some other common emotional experiences are that can overlap with cancer. So anxiety itself, when we hear the term anxiety and we're talking about mental health, we're usually there's a number of different anxiety disorders, but we're normally talking about something called generalized anxiety disorder. So there's lots of different symptoms. That sort of the flagship one being worrying most or all of the time, and then lots of other symptoms would include things like restlessness, agitation, sleeping too little or occasionally too much. Feeling like you can't settle down, aches and pains, stomach discomfort, all kinds of different things. I won't list all of them here. Like depression, which we talked about in our other video, there's a lot of overlap in symptoms of anxiety and symptoms of cancer and its treatment, including particularly a lot of folks get steroids with their chemo, which can be very anxiety-inducing and heightening. So it can be hard to parse out what's a symptom of your cancer, what's a side effect of your treatment, and what's a symptom of anxiety. So that's one of the really tricky things about mental health and cancer. The other thing is it's really normal to feel stressed and anxious when you have a cancer diagnosis. That's an incredibly stressful thing. So I think what you're getting at is how do you know when it's clinical, when it's an anxiety diagnosis versus just some symptoms of stress, right? I think the most important differentiator that might be a clue to say, okay, I need to at least be evaluated for this, would be that do you feel worried or anxious most or all of the time? So stress is going to come and go. It's part of the human experience, and so is anxiety to an extent. But when it's something that's with you most or all of the time, that's a sign that you might really need help. Another clue would be those physiological effects, like big sleep disruption, physical aches and pains that are new and unusual, and feeling like you can't settle yourself down. It can be hard to parse out is the reality of it, and it's not always easy to make a diagnosis of something like generalized anxiety disorder when someone's dealing with cancer, just because of all of those factors that can overlap. But if you think that you might be experiencing anxiety based on some of those symptoms that I talked about, it's definitely worth talking to someone on your medical team to see if they can do an assessment.
Really helpful. Cancer and its treatment are so disruptive. Your life's already busy, right? You're working, you've got kids, you've got family, you've got volunteer work, you have your place in a broken, hurting world, and then cancer just sort of lifts you out of your trajectory. No wonder people are stressed and hurting, and it can be isolating too. So you mentioned the symptom complex getting evaluated. One of the barriers to getting help can be people not taking it seriously, or other messages I'd love to have you talk about that people tell folks who are living with anxiety in the setting of cancer or life in the world in general. What kinds of things have you heard people tell you they've heard, and how should they sit with that and make sense of it?
Yeah, so people love to give free advice, and it's not always what you need to hear. So when you're dealing with anxiety, or even cancer-related stress that's subclinical, there's not always an immediate fix for that. It's not as simple as going to a yoga class or practicing mindfulness, although I should say those things can be really helpful. It's not it's not just as simple as just settle down and take a few deep breaths, right? When you're dealing with an anxiety diagnosis, especially on top of cancer, that can be a complicated thing to get under control. And so it's really important to get appropriate treatment from a mental health professional. And we'll talk a little later on about what that might entail. But to folks who say, because I've heard all kinds of things from the folks I work with about, people in their lives just saying, oh yeah, well, like, of course you're stressed, it's, and sort of brushing off anxiety or mental health symptoms as sort of like, just, toughen up, look on the bright side, kind of, silver lining, all that stuff, which is not my style. I think, when in reality, the best thing you can do for someone who's living with a mental illness is to listen, maybe, be quiet about it and not give advice, because treating something like anxiety when dealing with cancer isn't as simple as just taking a few deep breaths. Although again, that can be one of many things that can help. But yeah, I mean, the stigma around mental illness and thinking like, oh, it's okay, just kind of look on the bright side, is something that I think we're all in this field working on, hopefully combating, and I think it is getting a little bit better. But it's a really important thing to acknowledge that these symptoms are just that. They're symptoms. It's not just a feeling. When you're dealing with anxiety and you're feeling restless or agitated, that's not just, oh, I feel a little on edge. That's a symptom of an illness. And it needs to be treated exactly like a symptom of cancer would be treated or a side effect of your medication. So I am very much an advocate of mental illness should be seen as one of the most common symptoms and side effects of cancer, because it is. Depression and anxiety present in about 1 in 3 cancer patients, often with mixed symptoms. So, and actually the same rate in caregivers as well. And so, these things, that's more common than most of the symptoms you'll see on the side effect profiles of chemo treatment, so it should be taken just as seriously, and there's a lot we can do for it.
So you've talked a lot about treatment for anxiety, treatment for mixed symptoms. Tell us a little bit about treatment. Does it always mean medications? What other things? How do you go about talking with the people you work with about this?
So yeah, I do want to talk about treatment. And I also, anytime I'm talking about mental health, I also just always want to kind of jump in and mention that there is such a thing as a mental health emergency. So if you're ever feeling like truly out of control, if you're ever thinking of hurting yourself or hurting someone else, that's an emergency. So call 911 or go straight to the emergency room, and there are people there who can help you. If you have a family member who's in the house with you, you can tell them and get their help. But remember that if it feels like an emergency, it might be an emergency, and it's always okay to go to the hospital. So circling back to treatment, when we think about treatment for mental illness, I think when you hear that word treatment, especially if you're in treatment for cancer, you often think about medication, right? And medication can be a really useful tool in treating anxiety disorders. So in fact, for a lot of anxiety disorders, the first line treatment would be something like a low dose SSRI, which is a type of antidepressant. There's other medical treatments for anxiety as well. So depending on your diagnosis and your cancer treatment, and what your doctor or mental health professional thinks is appropriate, they'll make determinations about what might be the right medication for you, if that is a route that you go down. Others may not want to pursue medication or may not need to, and that's perfectly okay as well. Each person is different in what their sort of treatment requirements are. So, the most important thing you can do is get that assessment with a professional and find out, do I have a diagnosis of an anxiety disorder? And then what does treatment look like for me? So with or without medication, a piece of treatment is going to be, or should be, talk therapy. So that, unfortunately, access to therapy is not the same for everybody, but if it's something you have access to, I would definitely encourage you to utilize it. You may be surprised to find that there may be therapy available in your cancer center through the oncology social worker. There may be community organizations in your community that offer offer it for free, or you may even be able to find it online or over the phone. So definitely ask someone on your care team if you want to seek out therapy. And there are different modalities of therapy that might be used in the treatment of an anxiety disorder. Cognitive behavior therapy is a very common one that has shown a lot of good success in treating anxiety disorders. So it can be a huge help. And a lot of what you'll do in therapy for anxiety disorder is work on some self-regulation strategies that can help you actually calm yourself down when those anxious feelings get a little too heightened. And then beyond those, I joked earlier about, things like taking a few deep breaths or practicing mindfulness. The truth is that there's a lot of good evidence for those things. Taking a deep breath isn't going to cure your anxiety, but practicing, a daily mindful meditation on the breath might make a really huge difference as part of your arsenal in working against the anxiety symptoms. So, there are mindfulness and meditation professionals that you can find online. You may find YouTube videos that are good. You might find a local community organization that offers things like that. Gentle exercise can also be extremely helpful in managing anxiety symptoms. It can be hard because, you've got all this energy with nowhere to go. So, something like an exercise can help a ton to kind of get some of that energy out. But it can be tricky because you might also feel really fatigued. You might not be sleeping well if you're anxious, or you might be fatigued from your cancer treatment. So something as simple as a gentle walk, just to get your blood pumping, and, get you breathing a little bit faster, maybe get out in some sunlight and fresh air. That can go a really long way. Other things that can help, would be things like gentle yoga. You can find free yoga classes online that are gentle, even in a chair. So if you have any mobility issues, if walking isn't an option for you, gentle stretching, even in a chair, is a really good option. So to just move your body in a way that works for you. And if your cancer-related mobility issues or pre-existing mobility issues are problematic enough that you really don't know how to move safely, definitely talk to your medical team about that. So those are a few of the things that you can do. We talked a little bit in our video on depression, which you should check out as well, because they do often present with mixed symptoms, anxiety and depression, about things like journaling, gratitude practice, art for some people, music, whether you're listening to it or making it. I mean, there's all different kinds of things that can help you feel like you again. So just looking for those opportunities is a huge help, in addition to maybe a support group and or counseling and or medication. It's going to be a multifaceted approach.
You mentioned 911, and we've talked before about this, that when you call 911, what you want to do is ask for an ambulance. And the reason is so that you have not law enforcement, but actually trained medical people who can help you. So it's just something you and I have wanted to share before. And I appreciate your advice about that. That's really helpful. This has been really great, Rosie. Thank you so much for your time. If this video has been helpful to you, click like and subscribe. What that does is it helps other people who might benefit from this find this video. That's just how YouTube works. And don't forget, you can visit Yerbba.com to get your personalized report so you can see your treatment options and what you might expect.